Hi everyone, welcome to this presentation. My name is Erin, and you may have noticed that I've changed my topic from the ideas I'd initially prepared to discuss. Interestingly, my inspiration to explore this new topic came about through my recent experience with COVID, which I have somehow managed to avoid since the onset of the pandemic until just this week. Um, Not surprisingly, the onset of my symptoms seemed to have correlated with my recent increase in stress brought on by an impending change of station move and the myriad of challenges that accompany those kinds of transitions. Not to mention attempting to create a poster presentation that would provide an adequate representation of the culmination of my knowledge acquired throughout the duration of the program, and one that would be worthy of representing a UAGC graduate and online publication at this year's conference seminar. So, the pressure. But if you consider the scientific evidence on the detrimental impact of stress and lack of sleep and what that does to the body's immune system, it's really not surprising to learn that I became vulnerable to the illness at this particular stage of my life. Anyhow, what was surprising to me in this experience is that the impact this upper respiratory infection had on my cognitive functions and thought processes. So, as my symptoms worsened, I found it increasingly challenging to maintain focus and organize my thoughts and recall information I'd learned, and just engage the cognitive functions necessary to contribute to the discussions and complete our assignments. Between my experiences of brain fog, I recalled research on the neurobiological bases of behavior that we conducted in Dr. Nielsen's Psych 625 course, and I recall the impacts of inflammation on specific regions of the brain, including the prefrontal cortex, which is responsible for regulating executive functions, things such as planning and reasoning, attentional processes, things like that. So, while I'm uncertain as to whether my cognitive symptoms were primarily the result of my stress or the virus, or the combination of factors, one thing this experience has provided me with is a firsthand awareness of the neurobiological vulnerabilities that are created by environmental influences, and they can manifest as symptoms that resemble DSM diagnoses. For example, etiological theories on the development of DSM conditions like depression, anxiety, autism spectrum disorder, and schizophrenia, and a range of other conditions, have identified the role of complex interactions that occur between biological, social, and psychological variables, and they differ among individuals and they contribute to symptoms. While an individual may have a genetic vulnerability to a condition, the manifestation of psychopathology depends on specific environmental influences that prompt the expression of the trait. As such, these conditions are malleable and can be mediated through interventions designed to reduce environmental risk and increase protection. Although diagnostic frameworks provide the means to achieve consensus and guide treatment approaches, the stigma associated with mental health conditions create barriers that hinder many individuals from seeking needed support. Thus, the present study aims to inform the development of a framework that can reduce self-stigma by disentangling the person from the diagnosis, focusing instead on the interactions between physiological, genetic, biological, environmental, sociocultural, temporal, and dynamic influences that intersect and overlap in ways as unique and complex as the humans in need of support. A growing body of evidence has examined the role of stigma-related barriers in hindering help-seeking behaviors. However, there is a paucity of research on the intersections between mental health stigma, adolescent self-concept development, and the potential mediating role of shame and self-stigma that contribute to negative outcomes. Thus, the present study will include a synthesis of findings from research on the role of internalized shame found to mediate the relationship between ACEs and negative mental health outcomes. Triangulating the data from multiple areas of research can help answer the research questions that guide this review. Adverse childhood experiences, or ACEs, are significantly correlated with an increased risk of developing psychopathological conditions, and ACEs accumulate throughout the lifespan to increase one's vulnerability to a range of adverse mental health outcomes. Recently, the role of self-concept development has been identified as a crucial mediator in the relationship between ACEs and negative mental health outcomes. experiences of early childhood adversity disrupt typical identity development by creating recurrent and disorganized thoughts and feelings that are difficult to organize and lead to shattered senses of self concept that increase one's vulnerability to developing conditions of psychopathology later in life. Similarly, the internalization of shame that's characterized by self stigma is a significant factor of influence in the development of depression and suicidal behaviors due to its impact on aspects of a person's identity. Whereas guilt is concerned with what a person does, shame relates to who the person is. So, adverse experiences during childhood contribute toward the internalized shame that impacts a person's identity and sense of self concept. And it contributes towards a diminished self esteem and reduced sense of self worth. Similarly, the labels associated with the diagnosis can impact self concept development and can contribute toward self stigma. Because the adolescent stage of development is characterized by significant growth in domains related to self concept and identity, this population is especially vulnerable to the detrimental impact of stigmatizing labels that negatively influence identity and self esteem. Additionally, the adolescent stage of development is largely influenced by peer relationships, and positive interactions with peers help adolescents establish a healthy self concept and form a stable understanding of their role in society and their identity, whereas negative interactions and exclusion from peers can result in the development of maladaptive traits and contribute to psychological dysfunction. Clearly defined sense of self concept is positively correlated with measures of confidence and self esteem that help to buffer the negative impacts. In the transition from normal behavior to mental illness, the cumulative impact of multiple risk factors progressively increase one's vulnerability and likelihood of manifesting a condition in need of professional support. To help disentangle the diagnosis from the individual, Baker suggests the need for a paradigm shift to include an alternate taxonomy of conditions determined not by behavioral or biological manifestations, but in terms of the maintenance processes they entail. In the field of psychology, there's persistent debate on the merits of the DSM for enabling accurate identification of maladaptive conditions versus the limitations of its subjective criteria that has been suggested to inadequately consider the role of individual, cultural, and contextual variants. While universal frameworks provide the means to achieve diagnostic consensus, the stigma associated with behavioral health diagnoses can create barriers that hinder many individuals from seeking needed support. Holder describes the difficulty many organizations have in fulfilling their mission to support diversity, which can typically be attributed to the challenge in distinguishing between the concepts of diversity and inclusion. As Holder explains, diversity is like being invited to sit at a table that is already set. Inclusion is being asked to partner with the host to help set the table. To add to this vignette, we might consider the concept of equity as deciding which items should be included on the menu. By considering the perspectives of those who are disinclined to seek treatment for mental illness or disease, we might achieve a measure of consensus that is truly consensual and more respectful of diversity in all its dimensions. To alter the trajectories of those at risk of adverse mental health outcomes, we must essentially go back to the start and focus on supporting the critical sensitive periods of development by applying the use of evidence-based practices to help mediate the negative impacts. Please scan the QR code to view the references used in this presentation and a PDF version of the research.